Major breast cancer complication.
And WGN medical reporter Dina Baer explains.
Lymphedema can be a debilitating side effect of breast cancer surgery when lymph nodes are removed. It can cause swelling and pain, and there's no cure. But now, innovative surgeons are taking a different path to prevent the problem from happening in the first place.
Last year in August, I was doing my monthly self-exam and I felt a lump, and I was immediately, shocked and kind of frozen.
A breast cancer diagnosis is difficult enough. Add to that the surgical removal of the breast tumor, then a whole host of residual issues that impact quality of life for survivors. Jordan Cost felt the weight of a heavy burden.
My scans did show that I had some lymph node activity, so then that also started the conversation with Dr. Seth about the lymph node reconstruction.
Along with her double mastectomy, Jordan was offered an opportunity to avoid one of the most common complaints of breast cancer patients who have had lymph nodes removed or undergone radiation: lymphedema. The flow of lymphatic fluid is interrupted by surgery and treatment.
And so those lymph nodes are removed, it basically interrupts the flow from the extremity, from the upper arm to the rest of the body. And so then that fluid, over time then backs up down the arm.
I'm a marathoner, a 6-time Chicago marathoner. When I consulted with Dr. Seth, I told him, whatever you got to do, I want to run a marathon again. And, he was amazing. He's like, all right, I know exactly what we need to do.
Reconstructive breast surgeon Dr. Akil Seth helps women feel whole again after breast cancer. And for him, that means thinking beyond the breast itself. He helped pioneer a technique at North Shore University Health System to prevent lymphedema.
We have basically figured out a way, and this is, building off of people who taught me how to do this procedure and, came up with this, years ago, to basically, at the time that the lymph nodes are taken out, reconstruct the lymphatic system to basically give that lymphatic fluid somewhere to go.
First, they use dye to highlight the tiny lymph nodes. Then, with microscopic surgery, doctors search for small veins to reroute the lymphatic system.
At baseline, everyone's lymphatics eventually drain into your veins. We're basically rerouting the plumbing, so to speak, to try to get things to drain sooner.
After 30 patients over more than a year, so far, success.
There really is no downside to this. The risk of the procedure of what I'm doing is fairly minimal. It's a little bit of added time in the operating room. It takes me about an hour or so. But short of that, the actual surgical risk is pretty minimal. But the benefit is very high.
I feel incredibly grateful to have been given the opportunity to have it.
Up to 40% of breast cancer patients who have lymph nodes removed go on to develop lymphedema. In people who have this surgery, that number drops to only 2 to 4%. Back to you.